Tidewater Telecom built Lincoln County's first fiber-to-the-home network in 2011, we knew we were starting a project that would take years to see through. 9 years later, we are proud to have connected more than 2,000 Lincoln County homes to our blazing fast open fiber network. But that hasn't dimmed our vision to connect all of Lincoln County. Learn more about the power of fiber optic internet at tidewater.net.
Hager Enterprises, a paving and excavation contractor specializing in all sorts of site work, utility installations, and road construction since 1987.
LincolnHealth is one team working together to deliver the highest quality, personalized care. With that commitment, we're proud to introduce a fresh new look across all our locations. Soon, you'll notice a new logo and location names, making it easier to navigate the care you count on from the same care teams you trust. While LincolnHealth's brand is evolving, our compassionate and exceptional care will never change.
Committee meeting. So glad to see folks here. Just a reminder, we are streaming with LCTV just to make sure we're getting this information out to more people. And so thank you to the LCTV team for being here and helping with us. It's a great partnership we have. And as we say a lot, you have to work together so our communities are the healthiest in America, and working with LCTV helps us let you know what we're doing to keep our communities healthy. So appreciate that partnership. So today I'm going to do a presentation on some regional service work that we are doing here in the coastal region. I'll talk more about the coastal region. And then Jared is here with us. He's one of our physical therapists, and he's going to talk about falls prevention. And I was just last night reading Beth Kessler's newsletter on falls. Do you get that? Yes. And it's fantastic. It's all the things we're doing to prevent falls with patients, and if we have one, what we do and what we find and what we do to fix it. So it's a great newsletter that she sends out. And then we have Pam Hepburn will be joining us. She's the director of diagnostic imaging, so that's all things radiology. And she's going to talk about some things we've got going on in her area. And then as we have time allows, we'll have an update on a couple other projects that we have going on, but I'm going to start. And Revan is behind me running the screen, so I'm going to allow her. She says she hopes. So, and as always, if you have any questions, please don't hesitate to stop us along the way. That's what we're here for, is to provide you with information and answer questions. So please ask. So Just a little bit about the coastal region. As part of Maine Health, about 2 years ago, we broke into regions. And the reason we broke into regions is so we could collaborate more closely with folks that were closest to us in the Maine Health system. So there's 3 regions that have been developed over the last 2 years. One is the southern region, and that's Maine Medical Center, Maine Health, Maine Medical Center, Portland, Biddeford, and Sanford campuses. And so they all work together to provide care as a community in the southern part of our state. We have the mountain region, which is Franklin Hospital, Memorial Hospital, and Stevens Hospital, and they work very closely together. They also partner with Maine General and others in the mountain region to provide a comprehensive care model in the mountain region. And then here in the coastal region, which we are a part of, we have Midcoast Hospital, Lincoln Hospital, Penn Bay Hospital, and Waldo Hospital in Belfast. And we have come together as a team to work very, very closely together. These are 2023. We just finalized 2024 numbers, so they're not up here yet, but it's not so much about the numbers, but it's about some of the things that we look at and we've been working on, but it's also a snapshot in time of what we look like in comparison to one another, whether it's engagement with our care teams, or it's operating margins, or it's active medical staff numbers. So that's just a snapshot of what our coastal region looks like. So next slide. So as part of our region, we participate in the strategies that Maine Health has worked on. We have a 5-year strategic plan, and as part of that, every year we develop goals as a system, and then we develop goals that align with those in the coastal region. In addition to those goals, the coastal region thought there were some areas that we probably should be focused on as a region that might be slightly different than other regions are focused on, and that there was work that we could be doing that might help to develop our community as one region further and advance the work that we're doing together. So up here you'll see some of those buckets of work were a 5-year roadmap with specialty planning, and that was around clinical work, and I'll talk more about that. Leader collaboration, operations alignment, and I'll talk more about that as well. Clear the colon. The backing around that was we had colons that weren't getting cleaned or cleared, and we had a backlog in our region. So working together, we thought, how can we work together so that we alleviate the backlog of colonoscopies that needed to be done for our community members? So that was work going on there. And then regional operating room dashboard, which was some other work that we did to look at how do we provide surgical care in our region, and how efficient are we, and where do we have areas where we can access more procedure time in our ORs in our region. So I'll get a little bit more into each of them. But why did we? Overall, really, again, so that we can work together to provide the best care possible in our region. One of the things we've found is that you can't provide every level of care everywhere. I mean, we know that already because none of us provide tertiary care like Maine Medical Center does. But what can we provide between Belfast and Brunswick to our communities in an efficient, effective way? I'll give an example. So urologists, there's a shortage of urologists across this country. So certainly there's a shortage of urologists in the state of Maine, and especially the rural parts of the state. And when you look at urology in the oldest state in the nation, you know we need urologists, but you can't, and urologists want to have at least several other partners, so at least 4 of them in a group. They'd really like 7 in a group because call burden is so huge, and the overlap and the coverage for each other. So you can't provide 4 urologists at Midcoast, 4 at Lincoln, 4 at Penn Bay, 4 at Waldo, right? We're never going to get 16 for this region. We'll be lucky to get 7. And that's what we're working towards so that we can share that resource. So we're not going to be able to provide that exactly the same in each areas, but we're going to know how to refer our patients, how to educate our patients, and we're going to work together to provide that care. So that's an example of what we're looking at in our region around whether it's the actual providers providing the care, or it's the facilities to provide the care, the equipment to provide the care. How can we do that well? And so It's informing a lot of the work we're doing together moving forward and how we plan strategically, whether it's around capital investments, workforce investments, and education and training. So go ahead. Thanks, Robin. So these are some of the areas, and not to scare anybody, we're just in the process of evaluating all these things. And there's been an evolution working with the medical group, Maine Health Medical Group, in these areas, and working with what we call service lines, who are the groups that specifically work on an area of clinical care, like urology, like cardiology, like oncology. And so we've looked at how do we evolve, where do we put our time, money, resources in our region. And then we looked at two buckets. One was hospital care and one was outpatient procedure care. And you can see urology is in the outpatient procedure care bucket, as well as ophthalmology and ear, nose, and throat, also known as ENT. And we looked to see how's the best way to provide these services. There aren't 4 of every one of these for each one of our organizations in the region. So how as a region do we provide this care? And so we're digging deep into that and figuring out where the best place for care, how do we distribute that, what's best for our patients and our patient population. So a lot of work has gone into that. And one of the things, because providers, as I spoke to, they want to make sure that they have a good work-life balance. And if they're on call every other night, that's not good work-life balance. So we're really looking to relieve their call burden in this as well, because we want them to be happy, healthy, and we want them doing great work, high quality and safe care, and we want them to stay in our region. So then on the hospital-based care, you can see we looked at a couple of buckets. Do all 4 of us need true intensive care? No. And right now, Lincoln hasn't provided true intensive care really truly ever. We provide a higher level of care than in medical surgical unit, and we provide that level of care, and we call it a special care unit. But do we need to provide ICU level of care everywhere? No, and if not, where should we provide that, and how do we work together to do that? And so we've been looking really at what are we providing and what everybody calls their ICU, but they're really not all true ICUs. So how do we work on that? We looked at inpatient pediatric care. Across our region, we don't admit very many pediatric patients. Knock on wood, they don't get sick that often, except for last year when we had RSV, COVID, and flu going around, and every kid in the county had it. Every kid in the state did, one of the 3, if not more. But typically, high-level pediatric care happens at the Barbara Bush Center, Children's Center, and that's where it should happen. But we can provide other levels of pediatric care. If somebody needs to be observed overnight, a child, if they've got RSV or some kind of congestion going on and they just need to be monitored, we can do that. And so we're looking at how do we provide that pediatric care? How do we keep, because we all have pediatricians, how do we keep our team educated and focused on this work? I'm going to skip labor and delivery and go to surgical procedure care. Again, same thing. Where do we provide what types of surgeries? Where do we need to have lasers available or robots available to provide high level of surgical care? Maybe not anywhere in the region, but maybe a couple of the hospitals in the region. So really digging into that with our surgeons and trying to figure out what the best approach will be going forward. Labor and delivery, it's been a hot topic, and you might have heard that the Waldo Hospital Labor and Delivery Unit is transitioning out of labor and delivery care, and that care will be transitioned to Penn Bay. That was a long assessment that took place by the team at Waldo, looking at, first of all, volume that they had, and their volume has steadily declined, and they have less volume than we do here at Lincoln. And then where is your workforce? How are you doing on your workforce? And workforce, I think you all know, no matter where you go, it's hard to find enough people to do the work that we need. That's super true in healthcare. And so when you're looking for specialized labor and delivery nurses, OBGYN providers, pediatricians that need to be available, and OR 24/7 for C-sections, it came very evident that the low volume and the workforce issues led to this decision. That hospital will continue to provide prenatal and postnatal care and lactation care. Labor and delivery of moms and delivery of babies will go to Penn Bay or wherever the mom chooses. And they're working towards that as of April 1st. They'll transition that care. At the same time, Lincoln's been going through the same assessment. We also periodically review, deep dive into all of our services, but to align with what Waldo was doing, we wanted to see where did we fall in an assessment. Well, we have a little bit higher volume. Demographics are showing us that we have a slight increase over the next few years of people in childbearing age, which is good news for us. Our workforce is stable around pediatricians, labor and delivery nurses, surgical services. Where we are trying to recruit, and we have a team in the region working on this, is around OBGYN providers. We have nurse midwives and we have family practice docs that can come in and deliver, but you always need to have an OBGYN provider backing them up in any labor and delivery situation in case there needs to be a C-section or a critical need by the mom. So we're working on that recruitment, but right now we have a stable workforce. We're working on that one component, and we have the support of the region moving forward. So that's a little different between us and Waldo right now, but I just wanted to point that out. So that's work that got accelerated for lots of reasons for Waldo over the last year. So operations alignment is something that's near and dear to my heart and Brooks's heart. We work very closely together in the region on lots of different things, and this is a group of people that have been working closely over the last year to form relationships, trust, and build work that we can do together. So I'm just going to quickly go to the next slide. And some of the work, the 4 places that we focused on specifically were diagnostic imaging, environmental services, food and nutrition services, and therapies. PT, OT, speech specifically, but the therapies. And we brought leaders across our region together to work on where are we alike, where are we different, where can we leverage best practice, how can we work better together in the region, how can we share staff if we need to, how do we share scheduling and work queues so that we can get people scheduled as soon as possible for something in our region, and how do we just work better together. So we've been working really closely over the last year and we'll continue that work. And I won't go through every slide, but each group had a dashboard of metrics they were working on, and it was pretty impressive to watch those 4 groups over the last year, led by Brooks and his counterparts in the region, Joe Grant and Tyson Thornton to the north and south of us, and it's been exciting to watch those teams. And actually, Reverend, you can skip through a couple of these because they're all kind of the same. Other focus areas, that group's been highly engaged in our workforce violence prevention program, working with security, working with teams to make sure we're keeping our facilities as safe and our team and our patients and our residents as safe as possible. Also with sustainability, how do we decrease our emissions? How do we make ourselves more green going forward? Laundry and linen was a big deal at the beginning of the year, and then signage, and that signage is around our rebrand, which we've talked about before. Clear the Colon, which I talked about, again, a regional team has come together and have worked really closely with operations, with nursing leadership, OR, surgical services, and our surgeons, of course, to figure out how do we get that backlog of people needing colonoscopies, their colonoscopies more timely. And so a lot of focus and work has gone on that. We're still focused on that. We've made baby steps. We have much more work to do in that area, but it's important that people are getting their screening colonoscopies. And I would say patients have come to this campus from Brunswick to get their colonoscopies because we can get them in sooner here. So that's been a win. And we've also had Dr. Hassan go to Penn Bay to do colonoscopies because she had some time to go up there. She could get some of their backlog. So we're trying to work as a group in the region to get that backlog caught up. And then this is very busy. It's just to say that when we look at our surgical services, again, coming together, how efficient are we? Where can we provide more surgical access in our region? What types of surgeries can we do in each one of our hospitals? And how do we work together to do that? Again, to provide the best access to care for our community in the coastal region. And it may mean surgeons are moving because that's what we need to do. It may mean you get an option. Do you want to have your colonoscopy done at Midcoast? Do you want to have it done at Lincoln? You can come to Lincoln next week. It's going to be 3 months at Midcoast or what have you. But that's what we're trying to do, is to give our community more access to care by leveraging what we offer in the region. Leadership Collaborative, we couldn't do any of this without the leaders across this region, and we've had 2 educational and leadership collaboratives with all those folks, bringing all of those teams together. If we don't have strong relationships in this region, if we don't have strong trust in this region amongst our leaders, then all of this work won't get done. And this work plus lots of other work that we're focused on. So bringing those teams together, we've had great success, and it's been amazing to watch what can happen as people have formed new relationships, gotten to know each other, and worked on projects together. So we're going to continue that. But of course, the base of our success are the people that work in our hospitals. And so we rely on all of them to be doing this work. So, and Jared's one of those as I look around our team that's here. You can go on after that. So that's some of the work that's going on in the region. Any questions? That was a real high level kind of, just some sound bites of different things we're doing. Anything anybody wants to add from the team? No, wow, quiet group today. Okay, well then I have the pleasure, and let's see, how am I doing? Because I was worried, 9:18, I'm ahead of schedule. All right, so I am very happy to present Jared. Jared Tucker is a physical therapist here with us, and we are very grateful to have him. He's pretty dynamic, as our team is, but we have recruited some amazing therapists, and I'm gonna hand over to Jared.
All right, good morning, and thank you for the invitation to come speak this morning. My name is Jared Tucker. I'm a outpatient physical therapist. I'm the team lead here on the Lincoln campus, still getting used to that verbiage. We tend to treat quite a dynamic variety of conditions up on the Hill, but the focus of today is not only fall treatments, but also some fall preventions. So my goal today is just to give you guys some insight as to what we look for as we're doing balance assessments in the physical therapy realm, and give some tidbits to help prevent some falls outside of the clinic as well. Okay? So when we look at types of balance, there are so many that we're looking at. So when you come in for a physical therapy assessment, we're taking a look at a majority of these categories. So your anticipatory balance is when you've done, I'm going to use getting up from a chair as an example. You're doing a task that you've done before. What strategies are you using? How are you motor planning those movements? So they're things that you can plan for, you can prep for. Reactive balance is if you're in the grocery store, someone bumps into you, you're in downtown Damariscotta, someone stops to smell the roses, you don't see them, you have to stop on a dime. Things that you're not necessarily planning for. What does your body do to react to those disturbances? Okay? Limits of stability is how far can you reach outside of your comfort zone without having a loss of balance, whether it's reaching overhead into the upper cabinet, whether it's reaching forward, reaching down to the ground. So those limits of stability can be challenging for folks. Okay? Sensory organization is simply which systems are you relying on for your balance primarily. Okay? Typically we rely heavily on our vision. So if in instances where the power goes out, like what happened to me this morning with the rain, whether we're on some icy surfaces, whether it's busier environments, it's just assessing to make sure that all 3 contributing systems are being utilized in their appropriate capacity. So we're not reliant on one dominant strategy. Dual tasking, the classic walk and talk, can we walk and chew gum? Just making sure as your attention is split between tasks, how your balance is faring. And then static and dynamic balance when you're at rest versus when you're moving, how is that balance quality? So in a physical therapy setting, we have standardized testing for each of these. So depending on the clinical presentation, we may not be running through 45 minutes of exhaustive testing and having you need to take a nap once you're done because we worked you so hard, but we can get right to the point with some tests to figure out where those deficits are. Okay? So even outside of the physical therapy clinic, there's a lot of things you can do on your own to increase your stability, decrease that risk of falling. And the main concept is just staying mobile. Okay, they've done some research, usually around the 5,000 step per day mark is where that threshold is of increased fall risk versus decreased fall risk. But there are some strengthening exercises, some stretching exercises, balance, yoga, the local YMCA, gyms, group exercise classes. Those can all be incredibly valuable for fall prevention. And those are really what make up a lot of our home exercise programs when we work with patients, is figuring out what the patient's preferences are. You know, if we give you an exercise group that you really can't stand to do, probably not our most viable option. So patient preference plays a strong role. But realistically, maintaining your flexibility, maintaining your strength, maintaining that balance, the combination of those factors is what can help keep people safe, mobile, and healthy. Okay. There's also a lot of things you can modify, not necessarily physical modifications, but more behavior changes. So as you're walking, speed is a huge concept. We call it the keyhole theory. If I try and put a key into a lock as fast as I can, I'm probably going to put a couple dents in my door with the key before I get it into the lock. If I move that a little bit slowly, I'll be able to hit the mark on the first try. So within reason, the more controlled, the slower paced your movements are, the more accurate your movements are. And that can be the difference between having a trip and a fall and having that sure foot placement as you're walking. Okay. Environmental awareness, that comes down to a look before you leap concept. So even taking a couple seconds to scan the environment, you know, identify any potential barriers. Is there a rug on the floor? Is there a pothole in the yard? Is there a crack on the sidewalk I need to be aware of? So just planning ahead for some of these potential balance disturbances can be the difference between getting where you want to safely and having a trip or a fall. Okay? One thing that doesn't get talked about enough sometimes is taking your medications as they're prescribed. Medications can have some side effects if you miss a dose, if you decide to taper on your own, if you're doubling the doses. So those prescriptions, those recommendations are certainly there for a reason. So if medications aren't being taken as prescribed, or if you're getting side effects from those medications, it's really important to talk to your primary care physician to make sure that if any adjustments need to be made, that they are. So that that's not impacting your balance. It can make you dizzy. There's a whole host of side effects that can change your balance quality. Okay? Wearing good footwear that's supported, that don't slide around on your feet. The most common culprit are slippers. Okay? So any shoe that doesn't have a strong backing to it, your foot can slide around, and that can be the difference between, again, I take a step and everything comes with me, and I take a step and my slipper's behind me, and all of a sudden sock is hitting the hardwood floor, and that just makes life a little more adventurous than it needs to be. So just making sure that you have good footwear. The nice part is a lot of walking and running shoes, they're all very similar quality, but based on an assessment, your physical therapist can also give a recommendation for a brand and a style that can work for you. Okay? And then using assistive devices as needed. I think walkers and canes, they get a really bad reputation. It's not a sign of weakness. It can help you stay mobile, which can actually increase your quality of life. It can help you strengthen, and it can also help you avoid having to use the assistive device long term. So it's not a hardship. There shouldn't be a stigma around having to use a walker after a surgery or using a cane on an icy day. I use trekking poles when I walk. I'm clumsy. I've admitted it. Okay? So taking those proactive steps to help keep you in motion can be just as beneficial as anything we can offer in the clinic setting itself. Okay? There are also some home environmental pieces that you can modify. There is a fairly exclusive list here. I won't go through all of them, but we'll hit the highlights. Making sure that the floor is clear. So if there are throw rugs, if there are clothing piles on the floor, if there's any clutter on the floor, that can become a tripping hazard. Putting night lights onto common pathways. If you need to get up in the middle of the night, grab a glass of water. Making sure that the path you're walking is illuminated so you can anticipate, you can see where you're headed. Especially for those that rely on their vision so much for their balance. If it's dark, that can become a significant issue. Putting grab bars into your shower by the toilet, things of that nature. They don't devalue your house, okay? What they can do is they can make it more accessible. So if you have guests over, if it just makes your daily life more more easy, that's perfectly worth. Consider putting in some adaptive equipment. If it's hard to get off the toilet, they make risers that make it a little bit taller so it's easier to get up from. There are shower seats if you're having some trouble with balance on the slippery shower surface. So there are a lot of things that can be identified and put into the home at a very low cost. And the last piece here, there's lifelines or smartwatches. A lot of smartwatches now, if you've had a fall, the watch will detect it. You can link it up to your cell phone. It can call emergency services for you. Or the Life Alert, generally reimbursable through insurance. That's a necklace or a device you can have. If you've fallen, if you've had a medical alert, you can press that button and get emergency services to you quicker. So we don't have an instance where people are on the ground for hours or unfortunately days because they can't get up and they don't have the support. So these things, they're definitely those proactive approaches, and it simply helps keep you mobile and help you hit all those mobility thresholds to maximize that quality of life. Okay, so the last piece here is when to consider physical therapy. It sounds obvious, but before you have a fall, okay? Don't wait for something to become an issue before we do anything about it, okay? Proactive strategies are generally much more effective than reactive strategies. So if you're noticing that you're becoming more sedentary, you're having some nervousness or some fears of falling in some situations, I'm walking a little slower, I'm running out of energy a little bit quicker, talk to your primary care physician. They can do a medical workup, make sure that there's nothing medical, and if they're deeming that physical therapy is the most appropriate choice, we can bring you in for an assessment and start to get you on the right path before it becomes a larger scale issue. So again, if you'd like to get a referral, even if it's just for a balance assessment, talk to your primary care physician. They can generate a referral. Within the coastal region, we can absolutely accommodate, even if it's a one-time check-in, give you the reassurance that clinically things are okay, give you some guidance, give you some education. And there are tons of resources in the community. At the local YMCA here in Damariscotta, we have an Ask the Physical Therapist program. So from 8:30 to 9:30 on Friday mornings, there's a physical therapist present at the CLC YMCA for questions, for screenings. And if they're not able to answer those questions without a formal assessment, they can give you the guidance for those next steps. The YMCA, the Wiscasset Community Center, there's a lot of group exercise classes that can fill that physical and that social need as well. So our goal here between our physical therapy department and the community resources is to keep this community healthy, safe, mobile. So the more you can do outside with our help, I think the better we can achieve that goal. Okay. Are there any questions?
Jared, I have a question. You talk about how you get a referral for a fall or a balance assessment to see if there are things you can be doing.
Mm-hmm.
How do you assess somebody's home situation to help guide them? Is it through interview and discussion?
Primarily, we can, in some instances, do a home visit, and that's in the inpatient and the outpatient setting. So primarily, we are relying on an interview format. So I've had a spouse stay at home, and we've done some video calls in to do a home tour virtually as well. So we can really get creative within the confines of what's available. Yes.
Do you have a link or a website one could consult for kinds of exercises you would recommend to increase balance and ability?
I wish. So unfortunately, where balance is such a broad concept, it would honestly be an injustice to give blanket balance exercises since every need is so unique. So we can certainly give some references for some general strengthening options, but if we're looking for formal balance exercises, we prefer an individual approach based on your specific needs.
I recently completed an 8-week course that the hospital offered called The Matter of Balance, and it was absolutely outstanding. Absolutely outstanding.
That's excellent.
And it covered pretty much everything you're saying here. And not to mention you get a book that has these recommended exercises that are just outstanding. I just can't stop using the word. It's absolutely outstanding.
That's excellent.
Really.
Yeah, and another great example of those community resources. Yes, go right ahead.
Hi, Alex Farley. I live in Waltonboro. Glad to be here. I just wanted to say that I got a saying, can you connect your Series iPhone watch to what you were just talking about to track your heart rate? And I think that's one of the most proactive things I've ever heard a hospital doing. I unfortunately have a Series 3, so I got to upgrade to a 4. But it's worth it if you have a heart attack. And I think it's just amazing that you're doing that, putting staff in schools, and also, as I just heard, at the YMCA's and other public places. It's terrific. You guys are doing a great job.
No, we appreciate that feedback. Thank you.
And I will say an Apple Watch does work.
Perfect.
Not needed, but it, yes.
Yeah.
Well, the thing that's nice about the Apple Watch also, as Jared just talked about, was the fall detection. You know, you never know when you might fall at any age, and if you have that, it's a safety net, knowing it's not like you have to push a button. It detects a fall, and it's able to respond if you're not, right?
Absolutely. I got out of the way of some ladies and their dogs.
Dogs are definitely a fall hazard.
Very much so.
I don't think you're on his recommendation list.
Yeah.
Fantastic.
All right. Thank you so much for the opportunity.
Thanks, Jared. Good job.
Thank you, Jared.
That's awesome.
So fantastic. We're running a little ahead of schedule, so Pam, I'm sure, will be over. She had a meeting she was going to conclude and then come here. So I'm going to put Mr. Brooks Betts on stage, and he's going to update on where we are with with Waldoboro.
Okay, yeah. Oh, no, great.
There you go, our Waldoboro practice. It's an easy,
So I know
it's an easy one. Well, it was on the agenda, just saying.
Great. Good morning. Thank you, everybody. I apologize for the way I'm dressed. We're doing turkey delivery for employees today, and I need to be, at first, we thought it was going to rain, and so I was ready for making sure that I could stay dry today. So for the Waldoboro update, we have had many meetings, and we actually were at the town planning office, September, Cindy, to have a conversation with the town planning board in Waldoboro to just basically get an approval for the concept of what we were trying to do and get their feedback. And that went very well. That went favorable for us. So we are in the process now of getting kind of the final, we're supposed to have the final drawings today, which will allow us to, like the final construction drawings, which will allow our contractor then to come back with the final numbers for the project. That also will allow us, once we have those final drawings, to go and submit for a permit to the town of Waldoboro for the building. And right now, if everything goes well and the town is acceptant and gives us a permit, we could potentially have construction starting at least the groundwork in mid-December. So that's what the hope is. It's an 18-month project from there, but we're really going. We've still got a little bit of work to do on the finance side. We've done a lot of what they call value engineering to try to make sure that we get the size of the building and what we want in the building and how it's constructed in a way that we can afford. And we still got a little ways to go, and specifically because there's a couple of things that we want. We want to make sure we have an awning on the building. That's really important to us. As you've noticed, we've added an awning to this building after the construction. And the other thing is a generator for that facility, because we're in Maine, and we know that the power can go out, and we don't want to have to close the facility if we lose power. So Cindy, myself, and Revin and others were all working on trying to navigate how we go through those last financial things to make sure those ad options get in there for us. But the project is going really well. We've gone through all the security assessments, all the IT stuff, and furniture. So I mean, I think we're really ready to go. I mean, this project's really ready, and we believe, like I said, mid-December that we could have a shovel in the ground and the work could begin. Now, granted, we've got to get through the town still, so that's up to them. Yes.
Brooks, where is it?
It is going to be near the town office. There's a road called Depot Road, and it's just down back off of Depot Road on the left-hand side. And it's, if you remember where the Fieldcrest Nursing Home used to be in Waldoboro, off the center of town, so that is the property. So we actually purchased that property and one next to it, just so that we could open up the entrance a little bit. And the other thing that's really nice, I think, if you've seen the last meetings, we talked about our working with the town of Waldoboro. So the town of Waldoboro got a what's called a CDS grant, Congressional Discretionary Spending Grant, for $1 million to help with this project, and that's going to help with some of the infrastructure, so whether it's getting electricity in there, getting driveway in there, and ultimately the plan and what we've carved out on that piece of property is a space for the town to then be able to go and add a recreational center, because that's on their kind of strategic plan to put a recreation center within the community. And so this is really a joint effort between Maine Health and the town of Waldoboro. Julie Kaiser has been outstanding, as well as Max. We've all been working together, and it's kind of fun because, you know, going back to what Cindy said at the very beginning, working together so our communities are the healthiest in America, that's not just about going to the doctor. Jared talked about it, the YMCA, right? It's about being preventative and proactive. And so working with the town to do these types of things is really a positive for all of us in our communities. And it's something that Waldoboro needs so desperately. They need to have solid health care and good support there locally, as well as the recreational center will obviously be a huge asset to the community.
And where is Lincoln Medical Partners in Waldoboro?
Yeah, so we're off of what's called Old Route 1, which is down, it's kind of, if you're at the top of the hill in Waldoboro, you can split off and take Old Route 1 down the back. I don't really know how to get to it off the town, but you got to go down there, and it's down on your left-hand side. It's a building we've been renting for probably 15 to 20 years anyways, well 15 for sure. And then Penn Bay also has a practice down, and I don't know which road they're on, but it's down just around the corner from where we are. And that's the other thing, is that LincolnHealth and Penn Bay are working together, and this building will have the providers from both facilities, so all in one building. Yeah. Yes, sir.
Yeah, hi, Alex Farley. Net, when those facilities done and you've incorporated everybody from the Main Street facility, which is Lincoln Health.
Yep.
Mill Street, which is Penn. What's the staff that's going to be located at the building?
What's the staffing going to be?
Size, yeah.
That's a good. I don't really know. I mean, I think there will be space for a net gain there, but I think it's really more. Do you know, Cindy, if there's a much larger number that's going to be going in there?
We hope so. We hope so, I say, because in both of those facilities currently we are down providers. We've had retirements. As people are aging, they decrease to part-time. And so in both of those buildings, and we need to serve the Waldoboro and extending communities. So we are recruiting. So this building will house currently who are in those two facilities, which is less than what we'd like in those two facilities, to be able to have a significant number of physicians and advanced practice representatives and others that will work in that facility. And the plan is to make it big enough so that it, as we recruit to replace people that have retired. Well, so currently the staff all is somewhere, thankfully. And as we bring in new providers, housing is probably our number one barrier and challenge, as I think everybody's aware. And so we are working with different people to figure out housing initiatives. Where can we build more housing? Where can we find more housing for providers? For primary care, they're not on call. They're on call like 1 in 12 or something, but they don't have to be close to anywhere. They can do all their calls on phone. They don't have to come in to a specific place, so they can live pretty much anywhere. So we find some of our primary care providers live outside of, some of them live outside of Lincoln County because you can't find housing. But that is a significant barrier for us and concern. And we're working as a system on how do we work with others, again, working together, because we aren't the real estate gurus and we aren't the developers of housing, but how do we work with those folks to make sure we put housing top priority in this area. And actually we've got some people that have called us to connect up with, hey, if we build this size housing, can we partner with you on people that are coming into the county to live in these places? Absolutely, yes, we can partner on that. You have another question?
Yeah, one last one. We're looking at the Economic Development Committee of Waldoboro. We're looking at affordable housing and then also workforce housing, which are things. And I'm sure we would love to be able to talk with you about what you're looking at, and maybe we can allocate basically with.
That'd be great. And I know Stacy Miller, who's our Vice President of Physician Practices, she is very much connected with I'm drawing a blank.
Yeah, no, I was the one
In the,
looking into
oh, perfect.
for Main Street,
Yeah.
Okay,
Right,
perfect, perfect.
and now we're focusing.
So we'll bring that together at, Julie Kaiser. As we work on getting this built, we'll bring Julie in and others in, talking about what are going to be some of the needs around those kinds of requirements for housing and things. So thank
There's a
you.
question over here.
Not a question, a comment, and a thank you. You guys were awesome at your September meeting with planning board. And if it goes like that, it'll be a
Yeah, great. Yeah,
Thank you.
and we're very fortunate. We're working with WBRC and Sebago Technics, obviously they've got a lot of experience in this area, working with healthcare organizations, but also working with the towns. And it's, it's nice when they come prepared. We have everything that we need and questions can get answered. And, we have Jonathan Kasnow that's on the planning board in Waldoboro, but also on our staff, and he recused himself from voting, but he asked some good questions. It's important that we're held accountable to what the standards are that as an organization that we want to have that in the community. And so, we're just, that's one of the great things about living where we live in these small communities is that we all know each other, we work together, and we're caring for one another in one way or another.
That's great. Awesome. Thanks
Thank
for
you.
letting me put you on the spot. Another question? I'm sorry. Oh, Paul, sorry.
So, if any, especially at this point in the project development, are any adjustments between when you make plan to do here for episodic care for emergencies, walk-ins, things of that type, that need to be coordinated to the public safety services and so forth, or is there, or the EMS as part of that?
I'm not sure I understand. Did you understand the question?
No, not completely. I'm
It may be just looking ahead to what are the messages for the patients and for the community at large to know what your role may be in coordination with the public service agencies and others, if any.
And you're specific.
I did identify myself as being an early user of the walk-in clinic at the last meeting, so that's the kind of thing I'm thinking about.
Yeah, I think one of the things I think we've talked about it here at this committee before is knowing the right level of care based on what the need is. So if you're going to be going to the Waldoboro practice, that's more of a preventative, or you've got a cold, but it's not going to be an urgent care center or an emergency room, right? So it's a general doctor's office, much like this building is, although now we have the walk-in clinic here. So I think part of that is just making sure that all of our communities are educated on what services we offer in what areas, and so that when you're seeking medical care, you know where you should go for that level of care, right? So if it's emergency, obviously you're going to go to the emergency room. If it's something like I can't get in with my primary care, but I've got a temperature that I'm concerned about, then you'd come to the walk-in clinic, right? Those types of things.
And we do work very closely with EMS on all of our projects. So, but great point. Thanks, Paul. Sorry I didn't quite understand, and thank you, Brooks. So we do have Pam Hepburn here, our Director of Diagnostic Imaging for the Maine Health, Lincoln Hospital, Miles, and St. Andrews campuses. Whew. Did I get it right? I don't even know, right? That's good. Points for me on a Friday morning. So thank you to Pam for joining us, and come on up.
I do think you've got the coolest looking PowerPoint.
Right. Oh, thank you.
It's very diagnostic imaging looking.
Yes, I try. So thank you for having me. We have a lot of exciting things happening in imaging, and I'm always very proud to talk about it and give all the credit to the team for doing the hard work. These are the services that we have at Lincoln. We have X-ray available on both campuses. We are actually putting in new equipment on both campuses, new X-ray equipment, so that's very exciting. We have CT, bone density or DEXA imaging. We are currently working with the Maine Health Osteoporosis Task Force to increase access for bone density across the system. Mammography, ultrasound, nuclear medicine, MRI, echo. And we have a combined 38 registered technologists with over 400 years of combined experience. So when you come see us, you're getting good care with people that have been doing this for a long time, so as Marva knows. MRI, this was installed, some of you may have used our mobile MRI when it was parked in the parking lot. So really excited, that was here for 20 years. So excited to have this new technology. We built a brand new addition, it's beautiful, stop by anytime, we love to show it off. But it has allowed us to, it is a Phillips magnet, so there are some features, increased table weight limit, increased bore, which is the opening in the magnet in the gantry there, and a new area to screen patients, a bathroom where you can change. Before, we did not have that. So that's been really beneficial. Patients love that. We have something called an ambient experience, where if you can kind of see the lighting, and through the gantry there, you can see mountains. And that's proven to ease anxiety a lot of times if somebody's claustrophobic or they have difficulty with MRI. So that is a proven technology, and it has helped our patients. And again, the standardized technology, so it allows us to share protocol and collaborate. And a really impressive thing, keeping our patients here in the community, we have increased our access in 1 year by over 700 appointments. So that's a lot, and I only anticipate that to keep growing. We were able to increase our services from 4.5 to 5.5 days a week. So just adding that 1 full day and hiring a 32-hour additional technologist has really helped. And then our lung cancer screening program. This is something that we're very proud of. Our patients previously would have to go to Scarborough. That's where we referred them. So we have a nurse navigator. This is about 1.5 years in. She partners with all of our primary care physicians. They put in a referral if they think their patient is eligible for the program. Rachel then screens the patient. If they meet the criteria, they become part of the program. They'll get a CT yearly, dependent upon the findings. Rachel will then work with the radiologist and the providers. So much like mammography, this is a screening procedure. When you have your CT, you'll get a letter in the mail saying your findings were benign. If they're not, there is a group that's called Matrix, and that's a high-level group consisting of radiology, oncology, thoracic surgery, and nurse navigators throughout the system. And what they do is if there was a positive finding, which we would call a RADS4, it goes to this group and they evaluate it. And at that point, if you need additional imaging, biopsies, PET scans, our nurse navigator is able to expedite that. She works with the primary care physician and really gets that process going. We have been able to keep 300 patients in our community in just over 1.5 years. So, and it's growing. So that is a huge number for us. And lung cancer, as you know, is very prevalent in Lincoln County. So this is really impressive. And we are one of 2 sites in the region that has a nurse navigator for lung cancer screening or a program. So we do partner with them. And of course, something we're very proud of is our breast imaging program. We are the only Maine Health site to offer a breast imaging navigation program with certified breast imaging navigators. The purpose of the navigation program is to establish contact with the patient if they're requiring a biopsy or surgery at the time of a radiologist's recommendation. So if a patient were to come in, have a diagnostic mammogram, the radiologist feels that they need a biopsy or surgical consult, our navigators meet with them at that time. You don't go home and get a phone call, you're meeting with them right then and there. We also, or they also assess individual barriers to care. We partnered with Pause for Cause, and they have donated $7,500 in gift cards to be used for our breast program. So if patients are struggling with food, gas, we have gift cards specifically for that. It has improved timeliness and coordination of service, of course, facilitate doctor recommendations regarding care. The navigators discuss availability, location of resources. We are a member of the LincolnHealth Breast Cancer Work Group that collaborates monthly. We talk about all of the patients that are needing care, and they meet and they go over the process. And then there is also a weekly collaboration with a breast care team here at Lincoln. So you actually have a breast care team when you come in and you need those services. Surgery, oncology, radiology. So these are the services we have available here at Lincoln for our breast program. So diagnostic imaging, of course, mammo ultrasound, nuclear medicine, biopsies, MAG-seed. We performed nearly 100 biopsies this year. So those are patients that normally would have gone elsewhere. So 100 combined biopsies, that's a lot. Surgical lumpectomy and mastectomy, seed localization, that's where a little seed, magnetic seed, is placed in the abnormal breast tissue, and then it can be removed, the exact spot can be removed during surgery, so they know exactly where to go. Specialized breast care lymphedema therapist, oncology infusion, oncology social work provided at no cost to the patient, and registered dietitians on site. Our navigators coordinate all of this for you. Next, yeah, sorry. Oh, I don't know, it did work. And then Echo. So we were at a crossroads with Echo this is going on our second year, where we weren't sure we were gonna be able to provide the services because we didn't have technologists to perform Echo. We partnered with Midcoast. We were the first LincolnHealth collaboration with this regional structure. We have 3 cardiac sonographers that come here 5 days a week and provide this service to our patients. It allows, again, our patients to stay in our community, collaborate with cardiology, and we have performed over 1,000 echoes this year, doubling our volume in the last year and a half. And again, just looking for that to continue to grow. And then our newest technology, we just had a new CT scanner installed in October, and it is called a GE Revolution Ascend. Very proud of this. We're the first in Maine to have this scanner, second in LincolnHealth. North Conway's edging us each time. But it improved technology, faster throughput, lower radiation dose, larger bore opening, increased table limit. Our CT volume in the last 6 to 8 months has increased 30%. We are very busy in CT. Lincoln is on track to scan over 7,500 patients this year, at least, and that's just growing. And then we also have an Ulrich injector for CT. Again, first in Maine, second in LincolnHealth. North Conway got us on that one too. But the benefit of this is it's an injector that we use with our CT, and it allows us to use multi-dose vials, or bottles. And it's for less waste and improved workflow, and the intent on that is to save, the cost is $23,000 it's estimated to save us in a year once we're established with it. So very proud of this technology, for sure. And then something that we've been working on since we became the coastal region is our regional collaboration. I just left a meeting there this morning. We have a regional scorecard. So right now, one of the things on the scorecard is to evaluate access for patients within the region with a focus on mammography. Access for all imaging is really difficult throughout the system. It is challenging. I feel that we do the best within the region, probably the system, and getting our patients in. When they call, we don't often say no, and we're doing a really good job at navigating our schedule and making sure patients are getting care timely. And we were used as a model for our navigation work on how we can leverage that within the system. And so we meet bi-weekly and with the imaging directors and leadership from the coastal region. So as you can see, lots going on. I only touched on a few. There's a lot more things happening, but very proud of the work that we're doing in radiology. Yeah.
What are some of the difficulties you encounter when trying to make this regional setup work? And you've got to go to a lot of meetings. You're very busy in your own right. What are the barriers and how do you overcome them?
So each site does something a little different, of course, right? So I think the hardest part is just trying to standardize. So how do we, we pick small goals, achievable. Right now we're, I think there's, this morning we discussed, let's pick one policy that we can standardize, across the system. So start small, realistic. We have different radiologists. So that becomes challenging if each site has different radiologists, how do you standardize your protocols? So we're really working together as a system on that, on coming together, having those meetings, bringing everyone in together, system-wide, not just regionally, but system-wide to improve that. So those are some of the things that just figuring out what everyone's doing differently and picking small, achievable goals that we can tackle and move forward. Welcome.
And Pam and her team are really like leading the way on this regionalization too, right?
Yes.
Specifically picked this group to work on this first.
Yes. Yeah. We're doing. Yeah. And it's a great group. There's. The directors are amazing. Where Maine Health Imaging Council is an imaging council with directors throughout the system. We have been together for many, many years. It's a great partnership. We meet monthly, and great resources, collaboration, networking. So we really lean on each other. So imaging, I feel, I'm a little biased, of course, but is definitely leading the way in that. Thank you.
Totally agree with you, Pam. You guys are leading the way. We've got, Pam and I talk about this regularly. They've got a very robust imaging council that's been around for a long time. And that's about creating the relationships so that you can do that regional work, right? Once the people have all been working together for quite some time, they're having phone calls on the side saying, hey, can we do this together? Because it's easier than reinventing the wheel. So we've got several teams that are really great at that. So Cindy had to step out and head to another meeting. So I am going to wrap up for us today. I appreciate all of you coming. Before we close, does anybody have any final questions or any comments they'd like to make? Yeah.
Just a comment, a shout out. Yesterday I had an assessment at PT up the hill.
Yeah.
Finalized, they said you've improved. I have neuropathy in my legs. Everything you said is true.
Great. Yes. Exactly. Yeah.
Really apply it, and I think you ought to come over to Schooner Cove and make the same presentation so that people really understand it at the level that you're talking about it, which is understandable.
That's a great idea. I mean, that's an easy thing to organize too. That's easy to organize. We can work with Karen to get that set up for the residents.
And it could be done down in St.
Yeah, totally. I agree. Yep. Absolutely. Exactly. And any other questions or comments?
Very impressive.
Yeah, well, hey, thank you all for coming. We really appreciate your time and hope you have, it looks like you're going to be able to stay dry out there today, so we have a safe travel home wherever you're going. What's that? We won't drop any turkeys this afternoon. Yes, so those of you who don't know, it's been a long-standing tradition within the LincolnHealth family or Lincoln Hospital family that we give turkey. Today we give them out, so all of our staff get a turkey to take home to have Thanksgiving with their families. So thank you all. Have a wonderful day.
Work, utility installations, and road construction since 1987.
Built Lincoln County's first fiber to the home network in 2011, we knew we were starting a project. We are proud to have connected more than 2,000 Lincoln County homes to our blazing fast open. But that hasn't dimmed our vision to connect all of Lincoln County. Learn more about the power of fiber optic internet at
Maine Health is one team working together to deliver the high care. With that commitment, we're proud to introduce a fresh new look across all our locations. Soon, you'll notice the care you count on.